Hi, my name is Brian. I've been a Medicare supplement agent for over 10 years. I hope you enjoy the video you're about to watch. If you have additional questions, you can click on my name below, which will take you to my YouTube channel page, and you can watch any additional video that you like there. Also, at the end of my videos will be my name, my website address, and my phone number, where you can contact me and ask me any questions that you might have.
Medicare explained the easy way. In this video, I'm going to explain in detail things about Medicare that confuse most people. If you look in the description box below, there are chapters where you can click on the times for each section of the information that I'm going to give you. I will break down 10 important sections, including Number 1, terms used with Medicare. Number 2, who is eligible for Medicare. Number 3, the 4 parts of Medicare. Number 4, signing up for Medicare Part A and B. Number 5, the cost of Medicare. Number 6, what is a Medigap plan? Number 7, what is a Medicare Advantage plan? Number 8, Part D prescription drug plans. Number 9, I'm going to sum it all up. And number 10, why it's important to have a Medicare supplement agent. Throughout the video, there will be an I in the upper right-hand corner of the video. Click on these each time I mention a different subject that you might be interested in, and a video on that specific topic will show in that eye. You can watch the video after this one. This video is not extremely long, but with the eye that shows up in the upper right of the screen and the chapters in the description box below, you will be able to skip to any subject that you need quickly for more information on. It will also have links to my other videos in the description box. So let's get started with the video. Section 1, terms used with Medicare. Here are some terms to remember when watching this video. Number 1 is a premium. Number 2 is a copay or copayment. Number 3 is a deductible. Number 4, coinsurance. And number 5 is underwriting. A premium is the reoccurring monthly cost of the plan itself. This is what you pay to have the plan. A copayment or copay is what you pay each time you visit a doctor. It might be $20 copayment or $5. A deductible is the first amount you will pay before the plan picks up what they're going to pay. So you might have a $200 deductible before the plan starts paying for your care. Coinsurance is the percentage of the bill that you have to pay. Underwriting is when a company asks you health questions and then decides whether they're going to accept you into the plan. Please remember that term, underwriting. Section 2, who is eligible for Medicare? Medicare eligibility is for people who are 65 and older, or people who have been disabled for over 2 years. Medicare Part A is free of charge if you or your spouse worked 40 quarters in your lifetime and paid the Medicare tax during this time. A person must sign up for Part B during their initial enrollment period, which I explain later in the video, unless they are receiving Social Security benefits, Then they will automatically be enrolled in Medicare Part B. Section 3, the 4 parts of Medicare, A, B, C, and D. Medicare Part A, inpatient services, which includes hospitals, etc. Medicare Part A, inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care, if you are physically unable to get to a facility like a hospital. Medicare Part A, if you or your spouse worked for 10 years, 40 quarters, and paid into the Medicare tax, you will get Medicare Part A for free. You will not pay a premium for it each month. It comes out of your paycheck when you're working. If not, you can get Part A for a monthly premium. Medicare Part B. This includes outpatient services such as doctor's office visits, etc. Medicare Part B. This includes services from doctors and other healthcare providers, outpatient care, durable medical equipment, and some preventative services. Medicare Part B. Pay attention to Medicare Part B when you are initially signing up for Medicare. I will explain this in further detail later, but signing up for Part B is extremely important. Medicare Part B. The standard Part B premium cost in 2021 is $148.50. That's what you'll pay each month for Medicare Part B if you're in that tax bracket. If your modified adjusted gross income as reported on your IRS tax return from 2 years ago is above a certain amount, you'll pay the standard premium amount and an income-related monthly adjusted amount. Let's take a look at the standard amount to see if you'll have to pay more. Here is the standard amount that you will pay. If you filed an individual tax return of $88,000 or less, if you filed a joint tax return of $176,000 or less, if you filed married but separate tax return for $88,000 or less, you will pay each month in 2021 $148.50. Medicare Part C Advantage Plans. A Medicare Part C plan is just another name for a Medicare Advantage plan. Why they confuse you with this, I'm not sure. But I will explain this in further detail, and you can click on the chapter for this in the description box below to move to that section for Medicare Advantage plans. Signing up for a Medicare Part C, aka a Medicare Advantage plan, is optional. And if you click on the I above in the right corner of this screen, it will take you to a video strictly on Medicare Advantage plans. This next section is Medicare Part D, which is prescription drug plans. Medicare Part D, remember D stands for drug plans. Medicare Part D is the drug plans that are approved by the government. They are private companies such as AARP, Aetna, Cigna, etc., but their Medicare Part D plan is regulated by the federal government. Keep in mind that Medicare Parts A and B don't cover 100% of your costs, and they do not cover drugs. You will need to look at a Part D drug plan or an Advantage plan that covers drugs to cover some of the deductibles and co-payments you will be charged for with your drugs. Section 4. Signing up for Medicare Part A and B. A person can sign up for Medicare online at ssa.gov and click Medicare Enrollment, or they can go into the Social Security office to sign up. Some people receive their card automatically if they are taking early Social Security benefits. As I explained earlier, Medicare Part A is free of charge if you or your spouse worked 40 quarters and paid the Medicare tax during that time. Also, a person must sign up for Medicare Part B during their initial enrollment period unless they are receiving Social Security benefits. Then they will automatically be enrolled. If you don't want Medicare because your work benefits are cheaper or carrying a wife and children, you must opt out of Medicare Part B. This is very important, and I have it in another video of mine. Section 5. The cost of Medicare. Once again, most people get premium-free Part A. Medicare Part A is free of charge if you or your spouse worked 40 quarters and paid the Medicare tax during that time. If you look at your pay stub and see Medicare and money taken out, that's the tax for Medicare Part A. The majority of people get Medicare Part A for free, but if you don't qualify for premium-free Part A, you can buy it. It will cost either $259 or $471 each month in 2021, depending on how long they or their spouse worked and paid Medicare taxes. On to Medicare Part B. The standard Part B premium cost in 2021 is $148.50. If your modified adjusted gross income as reported on your IRS tax return from 2 years ago is above a certain amount, you will pay more. Look for the I above this video that further explains this premium for Part B. Now on to Part C. The cost of Medicare Part C, also known as an Advantage plan or Medicare Advantage plan, is different with each company and the plan they offer. Look for my video on Medicare Advantage plans in the I above and in the description box below, where I'll go into detail about Medicare Advantage plans. Section 6. What is a Medigap plan, aka a Medicare supplement plan? Medigap plans, aka Medicare supplement plans, help fill gaps in Medicare Part A and Medicare Part B. When you go to the doctor or the hospital, you show your Medicare Part A and B card and also your Medigap card, which will be a private company such as Aetna, Humana, Cigna, AARP, and those type of companies. There are 10 different Medigap plans, including the most popular plans such as the G plan and the N plan. These are government plans that are marketed, sold, and serviced by private companies. AARP, Aetna, Humana, and Cigna all sell the G plan, but it is the same plan, just with different prices. Try not to confuse Medicare parts such as A and B with Medigap plans such as G and N. Two totally different things. Medigap plans have underwriting unless you are in your initial enrollment period or have a special enrollment period. Remember, underwriting is when they ask you health questions and they don't have to accept you into the plan. It's very different than Medicare Advantage plans where they have to accept you and have no underwriting. Medigap plans have underwriting. You will either choose a Medigap plan or a Medicare Advantage plan to help cover the costs that Medicare doesn't cover for doctors and hospitals. This includes deductibles, co-payments, co-insurance, etc. If you want to know more about Medigap plans, please click on the I above in the right-hand corner or click the link in the description box below labeled Medigap. Section 7. What is a Medicare Advantage plan? Medicare Advantage plans, also known as Medicare Part C, are private companies that group all coverage together. The plans cover what Medicare Part A and B cover, plus most Medicare Advantage plans include prescription drug coverage, Part D, and also some vision, hearing, and dental coverage. Once you sign up for a Medicare Advantage plan, you can put your Medicare Part A and B card in a safe place because the Advantage Plan card will be all you need to show the doctor, hospital, pharmacist, etc. Medicare Advantage plans group all of these coverages together in one card. Keep in mind that Medicare Advantage plans are either PPOs, HMOs, private fee-for-service plans, or special needs plans. Also, Medicare Advantage plans do not have underwriting, so anyone can sign up for one of these plans. If you want to know more about Medicare Advantage plans, please click on the I above or click the link in the description box labeled Medicare Advantage, and we'll take you to a video specifically on Medicare Advantage plans and how they work. Section 8. Part D Prescription Drug Plans. Medicare Part D stands for Medicare Approved Prescription Drug Plans. These are private company plans that are approved by Medicare and CMS, which is the Center for Medicare Services. There are approximately 30 prescription drug plans in each state with different formularies and co-payments / deductibles. Part D plans can be very confusing to someone who is new to Medicare. There is no underwriting for Part D plans, so anyone can sign up for any drug plan offered in their area, but the deductibles and the co-payments are different for each plan and each drug within the plan. If you choose to go on a Medigap plan, you must choose a Medicare Part D prescription drug plan from the choices offered in your area. It can be any of the 20 to 40 plans offered from any company, including Aetna, AARP, Cigna, etc. So keep in mind, Medigap plans are like a buffet. You could have an Aetna Medigap plan and then get a Cigna Medicare Part D prescription drug plan, and then get a dental plan from Blue Cross. You group it all together, but they're not together as one plan. If you choose to get a Medicare Advantage plan for your benefits and get off of original Medicare, you must take that company's drug plan. For example, if you purchase an Aetna Medicare Advantage plan, you can only choose the drug plan that comes with that Aetna Advantage plan, which would be an Aetna drug plan. Section 9. Let's sum it all up. So here's actually what you have to do. Figure out if you actually want or need Medicare when you turn 65. If you want it, you need to sign up for both Medicare Part A and Medicare Part B. You have to choose either a Medigap plan or a Medicare Advantage plan. And you have to choose a Part D plan if you're going to choose a Medigap plan. And for the last section, Section 10, what a Medicare supplement agent does for you. We are customer service driven, and we cost you nothing to work with us. The companies pay us, you do not. It would be the same price if you went directly with the company. We go over the benefits of working with each company and give you many different choices to pick from. Not just one company, as if you called one of these Medigap or Medicare Advantage companies, you'd only get one choice. Also, we help you with your drug plan at no additional cost to you. We go over the formularies, we help you pick out a plan and so forth, and that takes a lot of time. We also help you with your vision, hearing, and dental insurance if you choose to get coverage. Once again, this is free of charge to you. Another thing is, we have an extensive list with 95% of the Medigap and Medicare Advantage companies on it. We show you all of them and help you compare them so that you can choose the right plan for you. Here are some of the companies that we work with. It's just a list: AARP, Medico, Aetna, Cigna, Blue Cross, Transamerica, Humana, Mutual of Omaha, Manhattan Life, and tons of other companies. Please watch some of my other videos on Medicare for more information, and they're all in the description box below. Medigap plans, Medicare Advantage, Part D drug plans, and so forth. Thanks for watching.